Hello, I'm Dr. Arturo Cordova, and today I want to talk to you about the Puerto Rico Diabesity Clinic, my new clinic created for optimizing the management of diabetes and obesity. The term diabesity was coined by Dr. Francine Kaufman, an endocrinologist and former president of the American Diabetes Association, to emphasize the fact that diabetes and obesity share the common cause of insulin resistance, and thus their treatment needs to be directed to reducing it. The sad fact is that this is not happening in Puerto Rico or the United States at the present time. An important part of the problem, as emphasized by Dr. Jason Fung from the University of Toronto, is that current management of diabetes is based on two great lies. This is, number one, that diabetes is a chronic irreversible disease, and number two, that the management of diabetes should focus on maintaining normal glucose levels. In reality, the fact is that diabetes can be reverted if treatment is directed to the reduction of insulin resistance and not to the lowering of glucose levels. Insulin resistance is characterized by elevations of insulin levels, which result from frequent increases in blood glucose during the day, which stimulate the pancreas to increase the production of insulin as a result of the current government recommendations for the treatment of diabetes, which emphasize a moderate carbohydrate, low-fat diet, and 6 meals per day. We consider these recommendations to be wrong and partially responsible for the growing prevalence of diabetes and obesity in our time, in view of the fact that they promote worsening of the insulin resistance. Because of these, the Puerto Rico Diabesity Clinic recommends a low-carbohydrate, moderate protein, high-fat diet similar to the famous and effective Atkins diet, using 3 meals a day without snacks, which then, combined with intermittent fasting, can reduce insulin levels rapidly, thus allowing for the reversal of insulin resistance and the reduction of the dose of insulin and other diabetic medications being used by the patient, together with significant weight loss. Patients with insulin resistance frequently have metabolic abnormalities associated to a high risk of diabetes and cardiovascular disease, including elevated fasting glucose greater than 100 milligrams per deciliter, hypertension, abdominal obesity, low good HDL cholesterol, and high triglycerides, collectively known as the metabolic syndrome. Insulin, also known as the fat storage hormone, is the most powerful hormone in promoting obesity. This is why at the Puerto Rico Diabesity Clinic, the reduction of insulin levels using the low carbohydrate, high fat diet, intermittent fasting, and regular exercise are the main components of our management of diabetes and obesity.